I'm waiting for this lag, y'all. I think y'all can see me. Boom, there it is. 3 seconds into this. All right. So, tea time with Dr. D. Got my tea here. Loving my cup. My girl Rachel sent me. I do something called whatever the fuck I want. I love that. So listen, with this tea right here. Saying share. God, Facebook has like so many things. How many of y'all get all these new updates on your phones? Like, do you want to share here, share there? Like, I thought I was already doing that by clicking live. Anyway, it goes to show you how much I do not keep up with all the changes on Facebook. So, real quick, because I'm in between sessions, I wanted to share with you guys a little bit about depression. I was on a little trip, so I really didn't have time to do my little tea time with you all. So, depression and what is it? I talked to a client earlier today, and obviously, I talk to clients all week long about mental health. And where people are often in denial about what depression is because you have that stupid commercial that I really hate. I think it's Zig, Lig, Lug. I can't even think of the name of stupid medicine, but they show this lady. She looks like a toy. She has this thing wound up on her back, and she's hungover. Like, and it looks like, this pill's supposed to help wind her up. And so you see the commercial with the person just like balled up in a corner somewhere, about to just run off a bridge. Okay, yeah, that looks like depression for maybe one or two people, right? A few people, but that's not what depression looks like for everyone. This is what depression looks like for many people. They feel sad at times, right? Than what they normally do. But some people don't feel that sadness at all because they tend to have a great outlook on life. What they may experience more so than sadness is lack of motivation or lack of interest in doing things. So if you're normally a person like me, I like to go out dancing, I like to go out and meet people, I like to go shopping, just go, 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 go. When that depressive episode comes on, it is more of a struggle for them to go out and do things. So they may sit there like, hey, I want to go dancing today, but like I really just don't feel like it. Or hey, I want to go to the gym today, I just really don't feel like it. Or tired. They experience fatigue. Depression has a physical component in it. So then in addition, they have changes in their appetite, be it up or down. That person may eat more emotionally, right? They just start feeling a certain way and start eating, or they may not have an appetite at all. They may notice changes in their weight, up or down. They have some cognitive problems where they can't concentrate, they can't focus, some of that executive functioning. They can't focus on things that they normally do. So they may be sitting at work, trying to work on a project and notice that they've been working on the same project over and over again, right? They notice that they have trouble making decisions. What else? They also may have feelings of hopelessness. Although they know that the world might not technically be ending, right? But they may feel like the end of the world, everything. They have these guilty feelings because they can't really do what they normally would do. In addition, they may also have thoughts of suicide, right? And doesn't necessarily mean they want to take their lives. They may just have this feeling like, what's the freaking point right now? Because they don't feel like themselves. Well, the challenge with dealing with mental health and specifically with depression is people don't accept that they're experiencing that like they would a physical symptom, right? Like if they hurt their back, if they were in a car accident, if they had diabetes or high blood pressure or something like that. They don't accept it the same way, so they deny it. And they'll say, yeah, well, I kind of just, haven't really been going to the gym like I normally would. I need a way to get myself to the gym. What I have to do is help them really unpack what their symptoms are and then help them understand those symptoms so then they can get to the gym. So the idea behind depression is there's not really a quote unquote cure for depression, but there is treatment for it. And the first form of that treatment is to have education to understand what you're experiencing so that you can accept it and then you can deal with it. You can't address a problem that you don't accept that you have. Medication, first question that people want to ask me is about medication. I'm not necessarily opposed to medication, but that's not necessarily my first go-to because oftentimes medication is rooted in the medical field, and many people in the medical field Look up the AMA, American Medical Association, is focused more on treating symptoms as opposed to the cause of those symptoms. So you could actually treat depression, depending on, you have to work with your medical providers with talk therapy and maybe medication management or changes in your diet for all that. You may have some supplements that are missing in your body that is causing depression. So we want to deal with causes. You may be able to treat depression just with seeing a clinical psychologist to undo some thinking patterns that you've experienced. So I just wanted to give you guys a little bit of education today about depression. You want to stop that cycle or slow that cycle down, right? You want to maybe not be able to, you can't necessarily get rid of the depression, but you want to decrease the level of frequency, how many times you experience depression, and decrease the intensity of those depressive episodes by doing healthy things to treat those. And first and foremost is to be educated about what it is that you're experiencing, and then see a professional like me. So do me a favor, click and like this post. I'm Dr. Danita Morales Ramos, aka Dr. D from Assert Yourself Mindset Coaching and Counseling. You guys going to crush your Sunday. I'm going to crush mine.